Hello, my name is Dr. Dewan S. Raja. Today I will discuss a few multiple choice questions in head and neck anatomy from question number 111 to 120. The answer key and the link for the textbook I will put in the description of my video for your kind information. Let us solve the multiple choice questions. Question number 111. The pharynx is attached above to the base of the skull and is continuous below with the top of the esophagus at which of the following vertebral level? Okay. Vertebral levels: cervical vertebra 1, cervical vertebra 3, cervical vertebra 4, cervical vertebra 6, thoracic vertebra 2. Answer should be D, that is cervical vertebra 6. Okay, we got that. Now we'll go to the second question. Okay, the basilar artery is formed at the lower part of the pons by the union of the two arteries. What are these two arteries? Two vertebral arteries, two anterior cerebral arteries, two posterior cerebral arteries, two middle cerebral arteries. Answer should be this, two vertebral artery. They enters the foramen magnum through foramen magnum from the transverse foramen of the cervical vertebra 6, 5, 4, 3, 2, 1. Then once it is in the cranial cavity at the lower part of the pons, the two vertebral artery unite to form the basilar artery. Answer should be the vertebral arteries. Two vertebral artery will unite to form one basilar artery that is passing over the basilar sulcus of the pons. The infrahyoid muscles depresses the hyoid bone, provides stable point of attachment for the suprahyoid muscles, sometimes referred to as strap muscles. Which of the following is not a strap muscle? Sternohyoid, omohyoid, thyrohyoid, sternothyroid, scalene anterior. So among that, these all are strap muscles, also called ribbon muscles. Only this is the exception. Scalene anterior is not a strap muscle. The common carotid artery bifurcates the superior border of the thyroid cartilage of the larynx between what? C1 and C2 cervical vertebral level, C2, C3, C3, C4, C4, C5, C5, C6. Answer should be this C3, C4. Okay, that is the answer. The stellate or cervicothoracic ganglion is formed by the union of what? Union of the superior cervical sympathetic ganglion and middle cervical sympathetic ganglion, middle cervical sympathetic ganglion and the inferior cervical sympathetic ganglion, inferior cervical sympathetic ganglion and the first thoracic sympathetic ganglion, second and third thoracic sympathetic ganglia. Answer should be this, inferior cervical sympathetic ganglion and the first thoracic sympathetic ganglion. There is the answer. They unite to form the stellate ganglion because it looks like a star. Also called cervicothoracic ganglion. Its size is variable. It may not form in some cases. So not necessarily these two will unite all the time. So its size is also variable. We must consider that. And the stellate ganglion, it is usually in front of the transverse process of cervical vertebra 7. The internal carotid artery supplies the brain and the eyeball. It enters the, question number 116, the internal carotid artery supplies the brain and the eyeball. It enters the petrous part of the temporal bone through which of the following? Foramen magnum, foramen ovale, jugular foramen, foramen spinosum, carotid canal. This is internal carotid artery. So it should enter through the carotid canal. The carotid sheath, question number 117. The carotid sheath is a column of fascia. This is deep fascia. Receives contribution from all of the following with one exception. The exception is investing layer of deep cervical fascia, pretracheal layer of deep cervical fascia, prevertebral layer of deep cervical fascia, platysma muscle. So this is the subcutaneous muscle present in the neck, okay, and it is subcutaneous. It is a muscle of facial expression that is not contributing in the formation of the carotid sheath. The cervical plexus forms in the substance of the muscles, making up the floor of the posterior triangle, within the subcutaneous tissue, investing layer of deep cervical fascia, pretracheal fascia, prevertebral fascia. What is the cervical plexus? Answer should be prevertebral fascia. The dura mater is innervated by all of the following cranial nerves with one exception. The exception is what? V1, there is the ophthalmic division of trigeminal nerve. Yes. V2, there is the maxillary division of trigeminal nerve. Yes. V3, the mandibular division of trigeminal nerve. Yes. So all the branches of trigeminal nerve supplies the dura mater. Then the vagus nerve, yes, it also provides innervation to the dura mater. How about hypoglossal nerve? Hypoglossal nerve is a motor nerve to the tongue muscles. It does not innervate the dura mater. The inferior thyroid artery is a branch of which of the following arteries? Costocervical trunk, thyrocervical trunk, superior thyroid artery, external carotid artery, internal carotid artery. Answer should be, what is the answer? Answer should be thyrocervical trunk, not costocervical trunk. It is coming from the thyrocervical trunk. Answer is B. Okay, we got the answer. Okay, and that's all about the multiple choice questions in head and neck from 111 to 120. If you have any question, please feel free to ask me. Please share the information with your friends, and please look at the answer in the description section of the video. You can also read some of the reference books there. If you can collect or may purchase, it is up to you. And please support my channel. Please subscribe me. Have a nice day. Bye now.